No audio. No, no, no. No. Turn your speakers up. Try that. Call the phone and we can put you on a speaker.
Can you hear me now?
Yes. There
Can
we
you
go.
hear me?
Yay.
Yay!
Woo!
Yay!
I'm like,
I-
okay. We've got a
my
lot
big-
of new people on here too today, Chris. And I think this is the perfect subject to talk about, just to have people to feel more comfortable that don't make it harder than what it is, right?
That's right. That's right. It's going to be
And here's
super.
and I don't know what you're going to be talking about, but one of the things I want to say is so many times people come on board and they try to learn everything. So I'm sure you'll address that too. So I can't wait to hear from you. You've helped so many families. I hear from people all the time. Oh my God, Chris just knows her stuff. You've got a team all over the United States. Things are happening for you. So so very proud and excited to have you on here today. So I'm going to turn it over to you, Chris. Thanks a bunch.
Well, thank you, Diane. I'm super honored to be here. I love helping people. It's been my whole life is to make a difference. And she's right. If you were going to die in front of me, you were coming back. You weren't going to stay dead. And that's a passion that you ought to have for your business, is that you don't want to let anyone go. You want to protect as many people as you can. You want to reach down and help them every way you can, because the more passionate you become, it goes from your head down to your heart. It's going to come out your mouth. It doesn't take much to separate yourself from one to the other. Now, in the beginning, when you're brand new, you feel like you're having to learn a lot of stuff. Keep it simple. We're going to show you how to keep it simple. The ATM will help you to keep it simple. And we're going to show you some of that today. And then I'm going to teach you tips and tricks on deep diving and learning, but rely on going. Most of you could get out and get going in a matter of a few days to a week. Now, you're not going to feel like an expert at everything, but the ATM makes you an expert. And the only thing I want to share with you right now, I don't care how massive the boot camp or anything, there's only one thing that you have to ever remember is who to call. Okay, that's all you ever have to remember is who to call. That's it. And you've got plenty of people to call to get help. And that's huge. And I remember, like Diane said, when I first started, I was in the office when all of that came to be, when the alliance came to be. So it was super exciting to have all this history. We only had one company, one product, and yet we still felt overwhelmed because we still had to learn how to set appointments, see clients. Anytime you start something new, whether it's a new job or you get a promotion at work, it can naturally feel a little overwhelming. Okay, but if you get in there and do it, this is a learn as you and learn and earn. It's an apprenticeship program. Learn and earn. And so, therefore, if you follow our simple steps, if you can read, you can do this. And I'm going to simplify so that the whole goal is to go out and help families, protect them, get the money to them that they need when they need it most. So people ask all the time, just like Diane said, what product do I write? I feel like I've got to know everything, and they get lost in the library. And let me tell you what, every home you go into is going to have a unique, different situation. Every person you speak with, what's going to work for one person may not work for another. So, yes, do we want you to understand your product so you can build value? Yes, but this isn't about selling a product. It's about helping them. And then you can use those products' features to help build additional value as they come in. So we're going to deep dive a little bit on this. And so people ask me, what do I write? Well, my question back is what do they qualify for medically? Okay. It's what are they going to qualify for? Agents, historically, and sometimes even in this company, they get so hyped up about a product. They get hyped up about IULs. Some of you may not even know what an IUL is, but it's worth getting excited about. There's annuities, there's hospital indemnities, there's all these neat things you can get super excited about, but it's not about selling a product. It's meeting the needs, okay? And it's also, what are they going to qualify for? You can get somebody all hyped up about an indexed UL, sell, tell them about all these wonderful features that it has, and then you get right down to it and they can't qualify for it. So the last thing you want to do is put the cart before the horse. Okay, and the ATM is built to do that. The goal is to find them the best program with the most living benefits built in. That means where they can tap into it. It's not just a death benefit, at the best price possible. ... that they qualify for. Okay, and it's really not as hard as you think. And it's going to take so much pressure off of you. It'll be absolutely amazing. Okay. So let's see here. So again, I brought up the ATM. As you notice, your whole goal is to simply gather data. That's a relief. That's a relief. You're going to get to know, the ATM is set up so that you get to know your client. You're going to be bonding with them. You're going to find out what they want. And then you're going to find out what they're going to qualify for. And you're going to do that by asking about their health and lifestyle. So you're going to ask questions. Ask questions. You even get the question oftentimes, well, how much does it cost? How much does it cost? Well, you don't know. Let's say you're casually out in the street somewhere, or you're talking with your family members. Well, how much would it be for this? How much would it be for that? And they're just generically throwing questions out, but you don't know until you get the details. Even your own direct family members. I don't know every medication my mother takes. She may have gone and gotten a diagnosis on something that she might have forgotten to tell me. She just turned 90. Can I cover my mother? Yes. Okay. But the main thing is I don't know if I can cover her unless I ask all the appropriate questions and what product to do. So the whole goal is say, you know what? That's a great question. It's going to be whatever you want it to be. We're going to get you the best program at the best price with the most benefits possible. Would this time Saturday be good for us to get together? Don't get pigeonholed if you've got your warm market into pinning a price. You just simply say, oh, that's awesome. We got a lot to choose from. So with this time Saturday, it'd be good for us to get together. We're going to get you the best program at the best price possible. It's absolutely amazing what's out there. I didn't even know exists. And just book the appointment. Just book the appointment, because if you're standing there talking to them, I don't care how healthy they tell you they may be, you say, well, that'll be great. We've got a number of options with this time Saturday. Be good for you. Okay. Don't get pigeonholed, because without that additional information and your ability to really kind of deep dive, it's hard to really give them an answer. And then you stand there, you're running around giving quotes all day and you're closing nothing. Your whole goal is to get an appointment and sit down and treat it with the proper respect that it should be due. That makes sense? This, again, don't mention products. I just tell you, don't mention IULs. Don't talk about a lot of Forrester benefits. You can say, we've got some amazing programs and I want to get to the best. It's really crazy what's out there. They've got some, you might mention a couple of vague things, but again, you don't know what they're going to qualify for. So you don't want to get them all hyped up on something. You can talk about tax-free retirement and tax-free benefits with this time Saturday. Keep it generic. Don't try to sell. You're trying to help. Get the need. Get them excited about that, but until they qualify. So if you're new, I just gave you a simple script with this time Saturday. If you meet somebody and they ask you and they pigeonhole you, that's exactly what you can say. Okay? So you set up an appointment. Now, when you get to the home, you're going to, like I said, get to know them, find out about them, bond with them. Do they have children, grandchildren? Were they, where do they live? What are their hobbies? All of those are actually going to be important part of the application. Where they work, what they do, what their income is. When you're bonding in the first page or two of the ATM, it's all about finding out about them, where they work, what is their income, what's his income, what's her income, how dependent are they on each other's income. Can they make their mortgage or rent payment if they should lose their job or if one of them passes away? Those are important things to help build the need from that type standpoint. But once you get down to a certain point, and you've identified what the need, what they're looking for, you're going to flip to this page and they're going to be looking at this page. Your job is to get the rest of the details. Now, you may see on here your financial picture, and they've got name, age, height, weight, tobacco use, medications, operations, how long with the company. So they're seeing here, and that's for him and her if it's a couple. Okay, so you're gathering the data on both of them if there's a significant other. Okay, what's their mortgage payment, monthly payment? Is there any retirement? All these things you can kind of write down. But then you're going to get into current policies, can see if they've got any backup plans already, criminal, driving, and deployment. But this page here, we're going to break it down to what they're going to qualify for. I'm going to break this sheet out for you. Again, you may have already gotten who they work with, how long they've been there, what their income is, their mortgage payments, any retirement policies. That's all part of the backup plan, okay, and what they have currently gotten into place for them. So now I'm going to deep dive in on your responsibility of finding out what they're going to qualify for. So some of this data you might have already gathered. Okay, so let's take a look here. All right, now, a lot of these questions are going to be on an application. All right, and you might have a place where you're going to write things down. In fact, I'm going to kind of skip ahead here real quick. Kind of show you something real quick. Is that I have a 1-page pre-qual form that's pretty detailed. It has children, height, weight, date of birth, your age, all this information that is actually on here along with health, lifestyle, and things like that. It's pretty detailed. And it helps. If you can fill out this page, you're in great shape. Now, you can use the green sheet too. It has some health questions as well, but not quite as detailed. And I'm going to show you the value of being able to ask questions. Other resources you can use is Get Out paper applications. Forrester's has probably the best detailed application to ask medical questions, lifestyle questions, and they have amazing questionnaires. And I'm going to cover that here in a little bit for you. But these questions that I'm going to cover, this section here, okay, it will help you to write the best product. So if you can ask the questions, then it's going to give us a good snapshot on their health, not just their finances, but on their health and lifestyle that can make or break which type of product we can put them in. Okay, so I'm going to break this section down with you. You'll learn something. Now, again, what I want you to know is you don't have to know all this. If you can read a question, I can post this in Band. If Diane wants me to, I'll be happy to. And I'll put it in a Word doc. So if your manager has some other things she wants to pop in there or can pass it out however Diane wants me to do it, okay? But it is, from a nursing perspective and underwriter standpoint, I've got the questions that you can ask. And if you can fill it out, it's going to have a lot of the questions that would be on almost any application. Major questions, not every detail, but it's going to help a lot. Okay, like Jack says, the product doesn't matter unless you figure it out. Okay, love it, Jack. Okay, that's right, Keto Stan. They tell you all the time they're healthy and they're lying through their teeth. Okay, all right. So one of the things you want to do is obviously get their date of birth. And you want the date of birth and the age, okay? Because their date of birth on some applications is current age, on other it is nearest age. In other words, a birthday coming up. Like my birthday comes up in January, so I would have to go to my next year. So if you get both, then you've got that data. They're going to ask it on an application. So you might as well write it down, right? And a lot of leads have this data already, but still you want to write it down. Now, next thing you want to do is make sure their height and weight. Like I had a lady who was 400 plus pounds the other day and was able to get a CVS pharmacy. She was healthy otherwise, but what I could write her non-med. And then last, use of tobacco, and that's any type of tobacco, any type. Okay, that could be cigarettes, marijuana, pipes, snuff, whatever the case may be. Having the last, and if you say any type of tobacco, don't say, do you smoke? Because they may not smoke. They might be chewing, and it still can be considered tobacco use. Cigars, how many times a month, how often, so when was the, and I put down here last use, because they could have quit a week ago, 6 months ago, a year ago. Typically, if you've quit tobacco for 12 months, it's a non-tobacco rate. Now, if you smoke a cigar 12 times a year, once a month, or, 2 or 3 times a year, some of the carriers are forgiving on that being considered non-tobacco. But, smoking is smoking. Cigarettes, marijuana, Foresters, it's important to identify the type, because even on a couple of Forester products can be considered non-tobacco. Marijuana used to be considered tobacco for every one of them. And it's how often do they smoke it. So for marijuana, it might be, Foresters had said 8 times a month. If it's over that, they consider 8 times a month or a couple of times a week recreational use. Over that, or if it's used as a prescription for a health issues, well, that might kick them out of a prime product or a healthy product, okay? Do you have to remember all this? No, you're gathering the data. You're going to be running this information by us, and I'm going to show that to you. So just gather the data. Don't stress out, okay? But some of this will stick somewhere, and we're going to teach you along the way. Another important thing is every application, virtually every application, I don't know one that doesn't ask you, except HMA, ask you what state you were born in if you're a U.S. citizen. That automatically makes you a U.S. citizen, right? So the other thing they'll do, and the application asks it, so you might as well put down the state they were born in. Oh, really? What state? Now, if you were bonding early on, you might have found out that they were from Nebraska and moved to Texas, 10 years ago for a job. So you might already know that, okay? That's part of the application. That's part of the bonding process, right? But if they were born in another country, let's say early on you found out they were born in another country, well, you want to find out what that country is, what is their social security number, if they have one, or tax ID, what type of ID do they have? Are they here on a work visa, student visa? All of that may matter on what they hear. And then how long in the U.S.? How long have they been here? Those are the common things that carriers are looking for if you happen to be here. Now, if you were a snowbird in Canada and you come down here, they want you, periodically throughout the year. They usually want you here at least 6 months out of the year. That's pretty average. That's typical for them. You have to have, they like for you to have been in the U.S. for most of the products at least a couple of years. Some of them will take maybe 1 year, but U.S. citizenship versus non-U.S. citizenship. So early on, when you're talking about where you were born, how long have you been here? You can find that on the very first page of the ATM, but it's important because some, like CFG, may take a tax ID number But a lot of the carriers won't take it unless you have a Social Security number. So it's very important for you to gather that data and to help you stick. Can we cover most people? Yeah. Is there something for people who are illegal? Well, HMA didn't even ask any of that because the Medical Savings Program can be used in the U.S. So there are things, out of the box things that we can do even if you're not here. So again, just gather the data, and you're going to use this to call us from the table. Now, another, when I did this PowerPoint, all of this was kind of where it was easier to read, but on the screen here, it kind of scrunched it up. Type, believe it or not, this has nothing to do with health, but it can make or break what program you put them in. Most of the carriers want you to have a checking or savings account, not a, dot credit express, card. All right. So if it's a green dot type banking card for people who have issues with getting a bank account for some reason or another, well, we may have to go to a whole different product with that. Okay. So they like checking, savings, debit accounts. I mean, not debit cards, but they want to be able to debit your checking and savings accounts. If they have credit card, debit card, or direct express Social Security card, that may change what we might even qualify them for, no matter how healthy they are. Okay, so that is an important thing for you to take note of. You can sell them a prime product, but they have no other ability to pay, or you may have to find another way for them to pay for that program to do that. Okay. Now let's get down to health things. Now, I like to break things up. Like Stan was mentioning, oh, do you have any health issues? Oh, no, I'm healthy. I'm fine. But then they're on 5 different medications, they're not healthy. Okay. Anytime you start going on medications for any reason, or their height, weight might be over the factor, you want to break these things up. Each of these are categories. So I look at both of them and say, so neither one of you have ever been prescribed medications of any kind ever, ever, ever. Okay, so I like to pull it out I don't like to pigeonhole it into in the past 5 years or in the past 10 years. I want to get them to thinking about their situation and being real. And I look at both of them. So neither one of you ever, and I'll phrase it like that. And I said, so even that's major, outside of an antibiotic for a cold, have you ever taken anything, even for a brief period, or even been prescribed medications? Now, so what I do, and that's it, they're telling me they're healthy. So what I do is get current medications first. What medications are you on right now? Okay, and I get the name, dosage, and the reason they're taking it. And the reason why I get current meds first, because that's what they're thinking about. That's in their cabinet. Okay, so they can pull it out, read the bottle, write down, the prescriptions and the name of the doctor. I also ask, are you on any as needed medications like inhalers? Okay, anxiety medicine, inhalers for asthma and things, and pain medicine. Those are the 3 most common as needed medication. Now, it's very important if you do as needed medications like a bronchodilator, they're going to tell you all the time. And I know Stan, Jack, Helen, everybody will go, yes, yes, yes. They're going to, when I ask them, well, how often do you take it? Most of them are going to say as needed. And when I ask them again, well, how often is that? Oh, I just take it as needed. They're going to tell you as needed oftentimes more than once. And so you have to say, okay, so how often on average do you have to take it? Is it once a day, once a week, once a month, 2 times a year, 5 times a year, 5 times a day? I'll say it to give them an idea, because it's important for you to get the average. use to figure out how severe the issue might be. The more severe the issue, the more they're going to be using that medication. And that just gives us an idea of what we're really dealing with. If you call us with medication that they take, I mean, shoot, I had somebody call me yesterday and said, well, they just take it as needed. How often is that? Okay, because it makes a big difference. And that way they can match it to the prescription bureau. If they say, oh, only take it 3 times a year, but they're getting it filled 2 times a month, or every 4 hours, as Stan says. Or they may say they take it every 4 and their prescriptions are filled 2 times a month. That is silly, So they're going to be taking what they say and matching it to the prescription bureau, and they can tell the severity of it. But you have to disclose it. If you don't disclose it, the carriers think you're hiding something. So that's the reason why I wanted to point that out. And then I mentioned, okay, now that I've got clarity on what they're on right now, I ask them if they've been on any major medication in the past, even brief. Any other blood pressure medication they might not be taking now, depression medicine, anxiety medicine. Maybe a mom or dad died, or they lost their job and they went through a depressive period and now they're not needing it anymore. But the carriers are going to see it. So if you break it up, the quality of your questions will determine the quality of your applications, and you get less surprises at the carrier. Okay, Jack, like, I only smoke occasionally. I'm around people at every smoke break. Oh, well. So if you break the questions up, you're going to get a lot better. And again, just learn to be diligent. You're not trying to fly through it. The more that the people know you're really trying to help them, then the better off you're going to be. Now, so we got medications. Now, I've had people tell me how healthy they are again, but they're on 3, 4, 5 medications. I'm healthy. Well, that's why I'm taking the blood pressure and cholesterol medications. I don't have a problem now. I'm taking it, but they tell you they're healthy, but they're on that medication and control it. That's what you run into. Okay, so just get it. Just break down out these categories. Don't take their word at it, right? Anybody want to go high five on that one? Just like you already have. Now, the next one, once I've gotten through the medications, I ask about operations. This only takes a couple of minutes, Operations. I say, okay, now have you had any operations of any type ever? I don't care if they're volunteering a tonsillectomy when they were 5 years old. I'd rather know it than not, okay? So I get the type, diagnosis, when, were they hospitalized for it? Oftentimes I'll even find out how long they were in the hospital. Did they need ICU, things like that, so operations. But independent of operations, you got hospital stays. I can remember one time somebody, the healthy. And then I said, oh, well, when was the last time you were in the hospital? That's how I said it. Or when have you been in the hospital? And they said, well, I was in there last November. Really? What were you in the hospital for? Oh, I got pneumonia from a cold. Oh, okay. How long were you in there? A month? I went, really? I said, that's a long time for pneumonia. Something must be, did you happen to go to ICU? And he said, yeah. And I said, how long were you in ICU? 2 weeks. Really? You were really sick. Did you have to go on a breathing tube? Yep. I was on it for a week. Now that's a whole different story, right? And I said, oh, so once you got out of the hospital, did you go home or have to go to a rehab? Oh my gosh, did they ever prescribe oxygen when you went home? See, it changes things when you can dig it out a little bit. And again, you'll get less surprises. Do you have to remember all this? No. Most of you, if you fill out a sheet of paper, again, they're going to ask some of this stuff, but it does provide clarity and it can allow us to help you. any complications. Now, a whole nother category, and you can type in any questions or comments or stories in the chat. Test, x-rays, MRI, EKG. Okay, so I find out when they've had what type of major test, lab work, x-rays. I'm a Columbo. If anybody knows, that's an old detective show. Okay, Columbo is a detective. Okay, they've got a lot of detectives since then, but I don't watch any of them, so I don't know their names. So test, x-rays, MRI, EKG. Have you ever had any of those tests, here in the past, few years? And I'll find out when, where, what, why, how, and for why. Okay. And what the results were. And so if you just get in a habit, it takes 2 seconds to ask it, but again, it can make you pop up, like EKGs might have been done for a routine physical exam, but an EKG could have been when they went into the emergency room for chest pain. Okay. So even if it came out normal, the care that's on an application is what I'm telling you. Okay. So if you might as well ask it up front, right? Gather the data. So now we've covered medications, tests, hospitalizations, operations. Now I get down to major illnesses or injuries. Okay. Have either one of you had any kind of illnesses, health issues, injuries, at all, any kind ever? And I get the date, the treatment, and have they recovered? Again, date, treatment, recover. Why? Okay. Now, on my cheat sheet, I have things kind of like a mini underwriting skill that a lot of the underwriters might ask and what they're looking for. Because you might put, yes, they had cancer in the box or diabetes, but then not know what details to get. Or, and these are what, if you can get this, then it's really good. So diabetes. All right, so let's go over just a little bit of this. Again, for all you new people, you do not need to be in medicine. You're gathering data. This is simple, filling out a piece of paper, right? And then you're going to call for help. We're going to tell you which product to write, okay? So diabetes, age of diagnosis is very important. If you were a diabetic when you were young, as a child, that's you. That's a whole different category. So once you start turning 30 and above, we've got options, especially if they're under control. You want to find out if they take insulin. You already got their medicine, so you might already know that by now. And what is their A1C or glucose level? Is it under control? A1C is kind of the benchmark for diabetes. And typically your normal A1C is under 6, really about 5.5 or less. Okay. If you start getting around 6, then you're starting to thinking you're pre-diabetic. 8 or less, over, some carriers will take you at 8.5 to 9. But again, that's just kind of giving you an idea. The more above 6, 7, 8 that it is, the more out of control it is, whether they're taking insulin or oral. All right. So just know that in the back of your mind. And that's what the carriers are looking for. Are you under control? How old were you when diagnosed? They're looking at how long have they had diabetes. If they've had it 25, 30 years, that sugar has probably torn the arteries up and they might have had complications. So underneath is a list of common complications that you have with diabetes. The most common one you see is neuropathy, which affects your nerve endings. Because sugar just tears your arteries and it tears the nerve endings up. So I'll get the top diabetes here, and then I'll say, so have either one of you ever had any complications from your diabetes? And I'll even list it. I'll say any diabetic coma, problems with your nerve endings, circulation in your legs, any amputations, heart, stroke, kidneys, wounds, eyes. And I'm looking at both of them. I remember, because they'll quickly tell you they have no complications. I'm sure there's a lot of people on here that'll go, yeah, no complications. And I remember one time when I went down this litany of complications that get had. So you haven't had any coma, da, da, da. And the guy said, well, yeah, I had 3 toes amputated last year. So again, if you name it out, the quality of your questions is the quality of your answers. And there's no way I would have seen he had 3 toes amputated in his shoes. So at least now I knew that he had complications and I could write the right product. So those are common questions with diabetes. Cancer, they usually want to know diagnosed when, what stage, 1, 2, 3, 4 is generally what it is. 1 being more benign. 4 meaning, well, you get to 2, it's already metastatic, but 3 and 4 are super metastatic. And then what type of treatments have they had? Surgery, chemo, radiation, when treatment ended. You want to always find out when the treatment ended, because a lot of programs we can get can be 2 years or more ago. We can get them if they've got cancer right now. But if they've had treatment ended, then what is their prognosis? Have they recovered? That kind of thing. That just helps us to know what to help you. Heart issues is more than a heart attack. I'm going to tell every agent out there saying, have you ever had a heart attack? Stop it. Stop it. There's a lot more to heart issues than a heart attack. Heart attack is where a heart muscle dies. Angina means where it's blue and pinks up before it dies. It's clogged arteries. It's basically what it winds up being. And the treatment for that is stent and bypass surgeries is to remedy the clogs of the arteries of the heart. But then you've got valve problems, murmurs, atrial fibrillations or irregular heartbeats, and they might have had defibrillators and pacemakers. So again, do you have to be a heart nurse to know that? Just ask the question. Okay. And again, when did they have any of these things done, the treatment involved? And that's as good as it gets. So again, I want to deep dive a little bit because those are some of the most common medical things. Other major medical things are like stroke, TIA, which is a mini stroke, transient ischemic attacks. Did they have any residual effects like paralysis? Have they ever had any liver issues of any type? So you want to deep dive on what type, hepatitis C, cirrhosis, fatty liver, whatever it may be. Any kidney issues ever, bipolar, depression, anxiety, attention deficit. Have they had COVID? That's a new one. It's on all the apps. And in fact, a lot of the carriers have an extra questionnaire just for COVID, or been exposed to others who have COVID in the household, or maybe have done some recent foreign travel. COPD and emphysema and asthma is another big one. Now, people can have asthma can be very mild, even from childhood. You've got mild seasonal asthma where they only need inhalers a couple of times a year. All right. So again, it's important to get the use. Then you've got asthma. They're needing breathing inhalers every day. Well, that's more severe, obviously. And asthma can turn into COPD, which is chronic obstructive pulmonary disease and or emphysema. A lot of people use the term simultaneously. And anybody with lung disease can get pneumonia. They can go into the ER. So again, all you have to do is ask. These are common questions. And again, it just helps to deep dive and let us know, what may be going on. Are they currently on disability? I remember Helen calling me from the table, healthy. And she was doing an over the phone app. And this guy said, well, yeah, I'm healthy. And then she happened to have asked, well, do you use a walker or a wheelchair? And he says, well, I use a wheelchair. He had been paralyzed from an accident. and he's on disability. So you can have healthy people who have had major injuries, and especially if you're doing over the phone apps, well, unless you ask that question, then you would have stopped at just the health, right? So again, just ask these questions. It's on one sheet of paper, makes it pretty simple, and it'll help you out. Okay. And like I said, it's not just health, it is also lifestyle. Some of the questions we'll have about driving violations. Why? Because it can be risky behavior. You might have DUIs, multiple DUIs, which driving under the influence, and not just alcohol, could be drugs, and that can really lead you down into alcohol drug questions. Okay, so you really want to ask about that. If I missed that, I apologize. But and also multiple speeding tickets even can make a big difference. If they have 3 to 5 in the past 5 years, each of the carriers can have a different time window. So again, just gather the data. Then, are they on parole? Do they have a driver's license? That might be another question you ask. If they have driving violations, they might have been suspended. Now, somebody who had driving license suspended due to parking tickets is usually not a big deal at all, because that's parking tickets. But it's these other things that show risky lifestyle. Now, they'll still pull a motor vehicle report, but they may not have a driver's license because of the parking tickets. Just disclose it. Now, felonies is a big deal. Felonies, you want to find out when it occurred. Did they do any jail time? Big important. Like foresters might go ahead and cover somebody who had a felony as long as they didn't serve any jail time over a year. So that's a pretty big deal on a prime product. Okay, so you want to find out what it was for, jail time, and when were they discharged out of jail? Are they currently on parole? And when are they off parole? If you know those questions, then you've got all you need to know. And you can ask those questions without making anybody feel bad. But let me tell you, I told you, that's right. And see this. So again, all you're going to do is fill out a sheet. I'm going to say that a million times. And I started this whole thing off. You don't have to know squat. All you need to do is know who to call. That's the reason why you can know everything about every product. But when you get into the home, this person had this person had that. Okay. And it's all going to change on you anyway. And you're not going to know because you don't know the underwriting guidelines. Okay. So all you have to do is fill it out, and we're going to show you a really cool way to do it. And that's how new agents who can go out there and just rely on their phone and on their resources, they're going to make a whole lot of money faster, and just fill out your data gatherer. That's it. It was like when I was a nurse and a patient came in to be evaluated for heart surgery or heart transplant or something. And I sat down there and I gathered the data. We weren't sure what we were going to do for them until we gathered the data. We looked at their test. Okay. We didn't put a treatment plan together until we got the data gathered. And that's exactly what you're doing here. And then you call the doctor in and cover it with them, right? Well, if they have risky behaviors, well, that's stopped them from being approved. Yeah, it'll just determine again on what product we write Estefany. Okay. Again, it's we will be able to cover them. We've got stuff, as I'm going to show you here, and I'm going to speed it up here real quick. But yes, it'll just determine what they can be. And yes, it can be more expensive for the amount because, again, it's kind of a subprime. So now once you've got the data gathered, I wanted to kind of deep dive. You're going to call. So who do you call? You're going to have a hotline mentor. Who is your manager's hotline mentor? Okay. For a lot of my team, call me. me, and we're going to show you the best way to do that. So you're going to want to store the phone numbers. Brenda Osberg, she's had a couple of numbers, so I wasn't sure which one to put in here, but she's the Lampe Agent Mentor Hotline. Mike Marisi's another backup mentor for them. And then you've got Gina Hawks, who is the product trainer over at the Alliance, and she's the IUL specialist. And then Ivy Wilson does our Medicare and Supplement specialist. So she's the Alliance Medicare and Supplement specialist. So these are the phone numbers. Put them in the table. You're going to rely most heavily on your hotline manager's mentor first, okay? And then you can put the other numbers in the backup. And I'm going to show you the best way to do it in just a second and make you look good doing it. Pardon me. So if you're brand new, I don't care how healthy they look to you. Make it a habit of calling from the table. I don't care how healthy, especially, you got Stan, I'll answer. So many people, there's Brenda's number. I'll write that one down. If new, call even if healthy. But if they're on medications, have health issues, just run it by us. Let's make sure we're writing the right product best as possible from the get-go. Now, another thing you can do during the week is call the carrier's risk assessment departments. It's only going to be during the week, though. And they don't always give you the best advice. So, but you can run it by to see what they would say and then still call your mentors, okay? Because they're only going to give you what they can do, and it may not be the best product. We've got a kind of a peer view to be able to look at all of the products, okay? That's right. Stan and I have talked to each other, right? Brenda and I talk. So calling from the table. Now, I know this is kind of small print here, and I could have edited it. But the main thing is many agents don't call from the table because they think somehow or another their ego is in the way. Ego and pride will kill you guys. Let me tell you. The goal is to protect families. And Colin helps new and seasoned agents by writing the right product, answer questions, assist with budget issues, quotes, even carry on into retirement questions and more. I mean, I have talked to so many clients all across the United States. My husband would call me 7 times from the table. I've had a lot of agents call me 3, 4, 5, 8 times with paperwork, even making sure they've got the new paperwork. And again, I'll show you how to position that because I know the paperwork's new and I just want to make sure I've got everything, or they've got a new procedure. Let me run it by you. It's all new to you. Okay, so don't be ashamed. Oh, the paperwork's new. You don't necessarily have to say you're new. You can say the paperwork's new, the software's new. We've had a lot of new changes since COVID. I'm going to run this by real quick. Okay, we're going to make you look good. I promise you. Again, it isn't what you know, it's who to call. All right. And again, agents can feel not called because it's not a weakness or people won't trust them. And this is so far from wrong. Clients have no problem. They're going to trust you more. They're going to realize you're a part of a bigger entity. You're not some Joe Blow coming down the street. Who are you? It isn't just you hawking a product. All right. You're a part of a big, legitimate national company, and that can provide a comfort level. And they also know that people don't care how much you know, they care how much you care. And so people like to know that you care enough that you want to take care of them. Okay. Now, hints real quick. You're going to close more for sure. That's for sure. Now, tips. If you're not picking up a check, okay, should have had that. If you're not picking up a check or getting that thing done, you call from the table. Don't leave a home if you're not getting them protected all the way down to the end, and just run it by us. Anything else we can do, I haven't thought about. Okay, give us a situation. Now, tip number 1, let your seasoned manager or agency manager know when your appointments are. So when we know when you're going to be out there, text, message, email a schedule, whatever it is. Agents at the table protecting clients will get priority over those asking questions. Okay. If you're calling and I see an agent call and they call one time, well, I don't know if you're calling to ask a question or if you're calling from the table unless you've let us know. Okay. Now, let's say you haven't let us know or, it goes to a voicemail. Redial. Just keep redialing. Text us, leave a voicemail, and just keep redialing. Don't just dial once and then, well, I didn't reach you. So many agents will call and not even leave a message. Well, I tried to call you. Well, you didn't even leave a message. I thought you were calling just to ask a question or just to talk. How do we know? Okay. So it's important for you to let us know so that we can be on our mark and be there to help. Okay. You can go to other people too. Have your rotary dial-up hotline numbers like I did, but do this especially if you haven't let us know seeing clients. Another tip I use, this is a pet peeve of mine. I hate it. Okay. I literally hate it. Use the people's name. Don't call them clients. Hey, I'm sitting here with Mary and Joe. Okay. People like to hear their names. It's number one. It's the sweetest name to every person on the planet is when you call them by their name. Okay. And use their name. Absolutely do not call them clients. I have agents who say, I'm sitting here with my client, blah, 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 blah. They're not your client. They're not your client until they're your client, until you've got the deal done. Clients mean they've already bought from you. I've had insurance agents before I was one come in and say, well, call me a client. And it's offensive to me. I haven't made a decision. And sometimes you don't know why you're calling them. It's because you might not be being personal enough and being respectful enough and using the sweetest name that right there will mean a lot to them. Okay. And tip number 3, don't automatically put us on the speakerphone. Ask us prior to speaking. Okay. Now so to kind of pull it all together real quick, go through the ATM, gather the data, tell them, you know what, I've got a good idea what might work the best, but let me run it by my underwriter, product specialist manager, whatever you want to call us, okay? And then call Hotline Mentor, okay? Tell us what they're looking for. I'm sitting and I'm going to go through the script here, but tell us what they're looking for. That gives us a good idea of what they might be going for, okay? Cover their why. I'm going to go through that in the script. Gather all the data. Get all the data. Tell us about, what's on the ATM on the financial page we just covered and details of any issues. Okay. So this is going to be the procedure. All right. So the best way to call, this is a sample. Hey, Stan, this is Chris. Listen, I am sitting here with Jack and Mary today. Oh my gosh, they are so awesome. They're wonderful folks. If you compliment them, again, a lot of people don't effectively call from the table and they don't use some of these cool things and compliment them. Oh, wonderful folks. They live in this beautiful home and they have really worked hard for everything they got. Okay. Now, Jack is really concerned. He knows if something happens to him, he passes away, Mary's going to lose his income. She might have to sell the home. And he realized, and so he wants to make sure Mary can keep the home or at least be able to make the mortgage payments for a while if something happens to him. And I kind of went into a little bit more detail, but he's not as worried about him because Mary, she's a homemaker, but he can take care of himself, but he wants to make sure she's well taken care of. Okay. Might look at a little final expenses for Mary. Whatever their why is, whatever their goals that they're going, that's going to give us a good idea of what to try to help you with. Okay. I have an idea, but I want to make sure I'm doing the right thing for them or the best programs they can be approved for. And so then you say, so let me tell you about Joe. He's 5'9", weighs 985 pounds. He smokes marijuana every single day. He has on these medications on dialysis. He's up for a heart transplant. So you can go from the top of the page down to the bottom and don't skip it. And then Mary has, you can go back and forth and tell us. And I tell you, it's huge. That pulls the full picture together for me. I mean, Helen, I've got so many people who are really good at going from the top of the page down to the bottom. But see, if you keep their why in front of them, now they're really, because it reminds them of what they just told you. Or they might say, yeah, we're just looking really for a final expense with Mary. I don't need the full thing on her. See, it can also help them correct that. That makes sense. It's huge. Keeping their why in front of them is why they buy. Okay. A lot of people think they're buying a product. They're buying why they're buying it. Okay. So hopefully that kind of helps you a little bit. I only got a couple more pages here. So when you call us, their health is going to fall into one of 4 categories. Okay. Now I call it the prime healthy program. Means they're relatively healthy. They qualify for the best programs with the cheapest rates. That can be your term, UL, mortgage protection, life insurance, can be an indexed UL. All of these are what I call prime products. Whatever you're wanting to do for that person is a prime healthy. They're going to get the cheapest rate. Final expense, if they've got major health, think common sense underwriting. If they've got strokes, cancer, heart issues, diabetes with complications, liver, if they've got some of these issues, do you think they're going to get a prime healthy program? No, they're going to fall into the final expense category. Now, there's still money. You might not call it final expense. They might be looking for final expense, or they may be having to go into that category because of health issues. Okay. Now, let's say they're too sick and uninsurable for even the final expense category. That's your uninsurable, your guaranteed issues. Example of that is felonies, AIDS, dialysis, Alzheimer's, transplants, things like that can fall into a guaranteed issue. So we got something for everybody. And then we got supplements that can fill in gaps all along the way. Or if they've got a great insurance product, you do. So all you have to do is gather the data. All right. And once this is how our brains are thinking, is which one of these programs, and you're always, supplements augment any program. Okay. And you can look at Bell's multiple apps in the home, Doug Becker, all that. We write multiple apps. So now I've got it broken down here in a nice picture snapshot. Kind of in the list, like I said, our whole goal is to protect them with the best program possible. So when somebody's calling me from the table, I'm going to be trying to think the best program at the cheapest price with the most benefits, okay? And so it almost falls down into this line. So I've got Foresters with their term, Smart UL, Advanced Whole Life. Will they qualify for any of the Foresters, Columbian Term, Mutual of Omaha? Lesser used as trans term, and then into your more advanced products of IUL. Okay, I'm thinking there. Okay, now which one of these I'll choose is what's going to be the most beneficial for the client and the cheapest with the most living benefits and their affordability. Okay, now they won't qualify here. I go second one. Got Moo Living Promise. They're the cheapest, but they hate diabetes before age 50. You can forget it, even on their final expense. Heart issues, things like that, you got to be healthier. They can be the cheapest, but they're not always will go through. And so this is kind of almost like and also ease of use. CVS has become one of my top ones, okay? And so this is kind of like a descending order. So you're clicking it off onto me. I'm going da-da-da-da-da-da, right down my brain, right? Now, they won't qualify for this category. I go to the guaranteed issue, Great Western and AIG. AIG is the cheapest, okay? But Great Western goes to age 40. Now, AIG has, I need to change that, but to age 80. but it helps you to get an idea of they've also got an immediate death benefit. So I'm not here to teach you the details of products today. I'm teaching you common sense underwriting. That's what I'm teaching today. And then supplements, we've got a plethora of them. So you can go to the supplements, okay? You can, again, you can have paper applications with health questions and questionnaires. If you don't have my cheat sheet, Forrester's has, these are the extra questions, all these additional questionnaires along with the questions on the apps. These give the underwriters the additional questions they need to make a simple decision. The applications by themselves don't. So if you want to just take around the final expense applications for all their questions to see which one it'll pop into, and then I have a folder just to carry with me too, with these additional questionnaires in case there's something else there that Forrester's might need. But if Forrester's needs it, almost any carrier is going to want it. So I carry all of my final expense apps in a folder so I can look at their questions and timing. And then this is a sample of the underwriting guide. You've got additional resources, and I've got on my computer, I've got all of the underwriting guides, but you can go to NEA University, go to .com, go under advanced resources to their underwriting grid, mortgage term. They've got two, mortgage term, which is really the prime products, not just for mortgage protection term. It's for any of our prime products. That's just how they have it labeled. And then final expense. And then the product grid has all of our products and all of the carriers listed. arc.nealeads.com under the carriers tab. Each carrier has underwriting guidelines there. So if you just want cross-reference, like if I know I'm going into an appointment and they've already told me all of their health issues over the phone, then I might go ahead and look at all the apps, go to my grid, and just kind of lead with the best products, okay, because I know the timing. And again, you can call the carrier's risk assessment. So use your additional resources. But again, what are you going to do? Who's got the answers? I don't care what you think you know or how new you are. All you're going to do is gather the data and know who to call. That's all you ever have to know. Gather the data and know who to call. Again, primary goal, you want to protect the clients and write the best thing there's some cases that's going to surprise you, but you're going to have less surprises if you do this. Okay, I promise you. Some people are going to be very borderline on their issues, and it's kind of hard to figure out which way they're going to sway. Okay, but usually I'll tell you that up front too. Call the mentor, be prepared to write, take an e-app if at all possible, because that'll help you with all the questions. Paper app, carry them with you, so in case you don't have internet. And I encourage you to deep dive on a new product or skill each and every week. Okay, learn about the living benefits. What does that mean? Take one or a new product, one new skill each and every week. Deep dive in on it to memorize it. You can utilize NEAU, everything there that you need to know. Thursday is the Alliance product calls with great sales tips. You want to attend all meetings because you get great tips in each and every call. I can't tell you how valuable that coaching corner is every morning, 8:30 to 9. They do such an awesome job, because the more you do, the more you learn, the more you earn. I didn't get to save people's lives, the deadest of the dead. I got good at the hard to do, and we are the masters of the hard to do. We're that's what sets us apart. Most agents who go into the table can only take care of one or two things, but say, oh, Joe had a stroke. Mary, I can take care of you, but I can't take care of Joe. We even have stuff for children. I know we got stuff for children who may have some major health issues, and people can't do that. They have to get up and leave the table and get kicked out. We walk in a home and we got something for everybody, guys. I'm telling you, all you have to do, don't try to be an expert. Be an expert question asker. And that's the ATM. That is that sheet of paper. That's calling from the table and get help. I remember doing my first annuity, I was scared to death. And so I had my carrier information in case I needed to call them. And this was back in 2003. And then I had somebody, a mentor, was a hotline, wound up being a hotline mentor, what we call them today. And that's how I sold my very first one. Is if they asked me a question I didn't know, I said, that's a great question. Let's get it direct from the horse's mouth. So don't make it complicated. Keep it simple. Got that simple sheet. It's so easy. If you just learn how to do it, call from the table, put your ego and pride aside. People do not care what you know. They really don't. In fact, they hate know-it-alls. And if you do that, I promise you, no matter how new you are, practice on yourself. Go through the ATM. Practice with your mentor. Schedule a time. You're going to learn so much out of it, doing you, your family, friends, relatives. You're going to protect them too and not have to come out of pocket with a bunch of final expense money because somebody died. Okay? I'm telling you, we've had so many deaths over the past year. Come on, guys. Let's practice. Learn to get good. Be a professional and enjoy it because, again, you're saving lives. And the more you want to learn and earn, I love learning, the more you earn, but you earn and learn at the same time. It's an apprenticeship program. You do it at the same time because there is no better way to learn than to get out there and do. Okay? Love you guys. Hope that helped you. There you go, Diane.
Thanks so much, Chris. That was so informative and awesome. And I know I look at the getting claps and thank yous and blessings and all that. And look at guys, pay attention. This will be on a rewind